Microsuture training and decide intermittent suturing of chicken wing blood vessels, trimming donor blood vessels at a 45-degree angle. Fleshing the lumen of the vessel. Expanding the anastomotic opening. Make an incision with a 1 milliliter syringe needle on the recipient's blood vessels, cutting the anastomotic openings to approximately 3 times the diameter of the vessel, ensuring that the size of the donor and recipient anastomotic openings is consistent. Stain the anastomotic opening with a ballpoint pen. Suture the first stitch at 12 o'clock. Suturing the donor blood vessel using the upward puncture. Tie 3 to 4 knots using the one-handed knot tying technique. Then cut the suture. Suture at 6 o'clock using the upward puncture. Tie knots using the one-handed knot tying technique. Then cut the suture. For the first stitch, insert forceps into the lumen to ensure that the opposite recipient blood vessel is not sutured. Elevate the outer membrane of the donor vessel. Suture after exposing the lumen, ensuring not to suture the opposite side. Tie knots using the two-handed knot tying technique. Then cut the suture. Note that different knot tying techniques are used in different positions. Continue suturing and knot tying using the same method. Pay attention to the length of the suture end when cutting. The last two stitches are continuous sutures with intermittent knots to avoid suturing to the opposite side. Cut off the suture ends. Inspect the opposite side and check for proper suturing. Insert forceps into the lumen to avoid suturing. To the opposite side. Apply equal force with both hands when tying knots, ensuring that the blood vessel remains undistorted while tightening the knot. Too loose may result in bleeding, and too tight may cause stenosis of the anastomotic openings, promoting thrombus formation.
Did anyone notice that my left hand is shaking badly? That's because it's almost lunchtime, and I'm hungry. Being in a rush to eat makes me a bit anxious. The more anxious I am, the more my hands shake. So suturing blood vessels really tests patience.
The last two stitches are continuous sutures with intermittent knots to avoid suturing to the opposite side. Cut off the suture ends. Inspect the anastomotic opening. Incise the blood vessels. Observe for full thickness suturing. And check if the suture margins and distances are consistent.